Okay. Again, I like to have group using on once a month. We're having him on 2 weeks in a row here because it's key information and it helps fund our operation. And that just is so essential. So it's a win-win. Why not do it? Let's talk to Larry in Michigan. You're on the air with Dr. Edward Group. Go ahead.
How you doing, Dr. Group? How you doing, Alex?
Good, brother. Go ahead.
I'm a member. I got a question. I'm 67 years old, had my ticker fixed 4 times. I got like 4 stents. What's good for me to keep my ticker cleaned out?
Well, best thing you can do to keep your cardiovascular system clean, one of the first things that we do is do liver and gallbladder cleansing, because if the liver is clean, the kidneys are clean, some of the other organs are clean, then, the liver can process some of those toxins that's floating around in your cardiovascular system. But again, addressing the gut, because taking it back, why your cardiovascular system is weak to begin with, the root cause, is because you're taking in too many chemicals and toxins or something that's destroying the walls of your cardiovascular system. So how are those things getting in? They're getting in through your gut. They're getting into the bloodstream through your gut. So I would focus on the gut and then also continually cleansing your system. Another way to strengthen the cardiovascular system is with exercise, pumping it, doing some exercise slowly with your case, maybe getting with a natural healthcare practitioner in your area. There's also some herbs that you can take to strengthen the cardiovascular system, but really focus on keeping your diet clean and increasing your water intake with organic apple cider vinegar and avoiding the plaquey substances, the white flour, everything that can cause damage to the cardiovascular system.
Yeah, well, I try to eat right, and I do a fair job. I'm not fat. I think it's a genetic thing more than anything else, because I'm pretty healthy, other than that. And,
well, it is true that there's predispositions for cancer or heart problems. But if you look at the numbers, though, a lot of this stuff's going up because of the additives, the fake sweeteners, the artificial fats. And they tell you all fat's bad, and they come out with these new artificial fats, and you see the studies, it's just like glue in your arteries, glue in your guts. It's really not rocket science that chicken McNuggets, and I'm not just picking on McDonald's, it's in most of the McNugget type stuff produced in China, has the base of silicone in it as a fluffing agent, so that the crispiness looks like, wow, that's really a lot of fried stuff there. And it's literally plastic. I mean, it's just like, what might be hurting you is stuff you ate 20, 30 years ago. That's just what I'm throwing out there. Dr. Group, any validity to that?
Yeah, it's a progressive thing. I mean, the thing is, they want you to be sick and slowly have, you're predisposed. As you said, you might have some genes, but it's been proven that just because you have the gene for breast cancer or heart disease or anything, that doesn't necessarily mean you're going to get that. Your
genes load the gun, but the environment pulls the trigger.
Exactly. That's exactly what happens. There's a couple other things, you can look into some EDTA, chelation therapy that helps clean the walls. There's an enzyme called serrapeptase that's produced by the silkworm, and that is really good for the cardiovascular system. In studies, it goes through and helps eat away some of the plaquing and strengthens the walls. Also, another enzyme called nattokinase, which is something that you should look at as well.
All right. Thank you, caller.